In this video, I'm going to talk about herpes simplex virus infection. So, herpes simplex virus usually enters the body through mucous membrane or the skin. And there are two main types, which are the HSV-1 and HSV-2, the human herpes virus. So the HSV-1 is usually associated with lips and skin lesions, whereas the second type is associated with genital lesions. But both viruses can manifest as both types of disease. So the clinical features of herpes simplex virus infection includes some features at the oral cavity, and which is gingivostomatitis, which is the most common form of primary HSV illness in children, mainly age range from 10 months to 3 years old. So in gingivostomatitis, there will be vesicular lesions seen on the lips, the gums, the anterior surface of the tongue and hard palate, like shown in this picture over here. And this often progresses to extensive painful ulceration together with bleeding. The child will have high fever and usually they will look miserable, and this feature may persist up to 2 weeks, and they will be associated with painful feeding and drinking due to the ulcers, causing dehydration in some children. So other clinical features include those features on the skin where there are cold sores, eczema herpeticum, and herpetic whitlows. So cold sores is when there is recurrent HSV-1 lesions on the lip margin, whereas eczema herpeticum is where vesicular lesions develop on the eczematous skin. And for herpetic whitlows, there are painful erythematous, edematous white pustules on the site of broken skin on the fingers, shown at this picture over here. So besides the skin and the oral cavity, there are also some features seen at the eyes, which is the Blepharitis, the inflammation of eyelids, or Conjunctivitis. And for the eyes, it may also spread to the cornea, causing scarring of the cornea and then later loss of vision for the child. Whereas for CNS, the central nervous system, there might be complications like herpes simplex encephalitis. And this encephalitis has a very high mortality rate, which is 70% of mortality rate if left untreated. For treatment of herpes simplex virus infection, we can give acyclovir to treat the symptoms, which are seen on the skin, the eyes, the cerebrum, and the systemic infections, and also ensure adequate hydration for the child by giving IV fluids. That's all for my video. Thank you.